I'm Dr. Brian Collins. I am the medical director of the Radiation Oncology department at MedStar Georgetown University Hospital. I'm a member of the oncology team, and I specifically see patients that require radiation therapy as a part of their care. In 1996, I came to Georgetown as a medical student. I had experienced for the first time taking care of oncology patients. And I was just fascinated with radiation, how effective it could be at eradicating tumors and making patients healthy with very severe illness. When I first started with radiation therapy, we were able to eradicate tumors, but we often left patients with severe damage from the radiation. So over the last 20 years, we're doing a much better job of decreasing the side effects and risks of the radiation while maintaining our high cure rate. Proton therapy is an option for all cancer patients. With time, it'll be more and more important to limit the radiation toxicity, and protons can help us do that. With protons, we can use less radiation to eradicate tumors and therefore do less damage. So it's clear that in the future we will use protons rather than photons to treat cancer. The reason you should come to Georgetown for radiation therapy is that we work as a team. We tailor the radiation to your needs, and we have all the technology we would need in order to be very specific to your care. The majority of radiation patients can live a relatively normal life as they receive their daily treatments over several weeks. It's an honor to be able to have patients trust you, allow you to take care of them, and have excellent outcomes, and share that joy with them. I think everybody I know has had someone in their family that has died of cancer or suffered greatly. So I want to have an impact on cancer care. My grandparents died from cancer. So when I came to Georgetown in 1996, I was so impressed how radiation could eradicate tumors so reliably. So therefore I chose to pursue it as a career. Photons are packets of energy. They have no mass, so they go through matter. They go through tissue without stopping. Protons have mass, and when they interact with tissue, they stop. And by stopping, they spare the normal tissue beyond the target. Protons are high-energy particles. When they interact with DNA, they disrupt the DNA. Normal cells can repair disrupted DNA. Cancer cells cannot, and because they cannot repair the DNA, they die. HYPERSCAN is the newest form of proton radiation therapy. HYPERSCAN is important because with proton radiation therapy in the past, it's been difficult to shape the beam around critical structures. With the HYPERSCAN, we can use multiple shields to shape the proton radiation beam. This is the optimal way to shape this type of radiation. The HYPERSCAN can shape proton radiation better than any other proton system. Proton therapy can treat all tumors. However, we do often use it for tumors in difficult locations, specifically brain tumors, lung tumors, liver tumors, and pediatric tumors have the major advantages. With conventional radiation, when we aim at a target, we deliver full dose radiation in front of the target and full dose radiation beyond the target. With the protons, they can stop in the center of target and only deliver radiation to the center. The brain is a very sensitive organ in the body. The more radiation we deliver to the brain, the more cognitive dysfunction we cause, the more memory loss we cause. So if we use protons, we could use half as much radiation and therefore leave patients more functional after treatment. In particular, we use protons for liver tumors because the liver is very sensitive to radiation, and if we can use less radiation, we can preserve liver function. The majority of patients with lung cancer also have lung problems or dysfunction. So with conventional radiation, we damage a lot of normal lung, leaving them with difficulty breathing. If we use the protons, we can minimize the difficulty with breathing, so we often choose to use protons. Pediatric tumors are rare. However, when we do address pediatric tumors, children are very sensitive to radiation. The reason is that they're developing, and their cells are very prone to developing additional cancers if irradiated. So therefore, with proton radiation, we can deliver half as much radiation and still eradicate their tumors. So we prefer to use protons for children. There are certain pediatric tumors that require irradiating approximately half the body. In that situation, conventional radiation causes significant damage, and the patients don't typically mature normally. So with protons, we can minimize that damage and hopefully have a better functional outcome for those needy children. Once you have a diagnosis, we have experts in each area. You will meet a specialist in your cancer type. They will have all the radiation options that you might require, and they will select the best one to eradicate your tumor while maintaining your quality of life and good health. We'll often choose protons because of the less radiation necessary. With the HYPERSCAN, the proton beam is further shaped. The shaping is important because we want to avoid certain normal structures in the body, and protons allowed us to do that. With conventional radiation, the photons travel through the entire brain and don't stop. With protons, we can have the particles stop right where the radiation is needed and spare a normal brain. Proton therapy is an excellent treatment for prostate cancer. By using protons, we can deliver less radiation to the body, having less acute side effects, and decrease the risk of having second cancers in the future. Proton therapy is a good option for breast cancer. Historically, it hasn't been used for breast cancer, but in the future, I think it'll be used often in breast cancer to limit the amount of radiation to the heart and to the lungs. When patients come for proton therapy, we will escort them into the proton room. They will lay on a table, and we will immobilize them, usually with a mask or a bag. Once immobilized, the therapist will leave the room, and the patient will receive approximately 5 minutes of radiation. Once the radiation is done, they are free to go home and will feel relatively normal for the rest of the day until they return the next day for their next treatment. Patients receiving proton radiation receive radiation Monday through Friday, once a day, for 5 to 7 weeks. MedStar Georgetown University Hospital, we have experts in the field, and we have all the technology. So we tailor the technology to your needs rather than using the technology that we have. I really think it's going to change the field of radiation. We need to be able to eradicate tumors with minimal toxicity, and protons is a major step in that direction. The risk of developing a second cancer is related to the total amount of radiation that you received. So if you can decrease the total amount of radiation delivered, you can decrease the chances of getting another cancer. It is my opinion that protons will replace photons in the future. The reason being that with protons we can accomplish the same goals with less toxicity.